free coronavirus testing.
Okay, so let's get started with how do you write objectives. I'm calling it a four-part method because there's really four pieces to an objective. So the first thing is the condition, what you're looking to accomplish, sort of the testing situation. Who, in objectives, behavioral objectives specifically, should always be written about the learner. They are not about the nurse. They are not about the teacher, all right? Performance is what behavior do you expect the person to demonstrate when you're over? And the criterion is the quality or quantity of what you expect to see. So, we're going to look at some objectives in just a second here, next slide. But I also want you to use the an acronym SMART. I think it's the easiest way to measure your objectives when you write them. So remember, an objective is how you break down your goal for teaching. So let's say you want to teach a diabetic, you're doing discharge teaching for a diabetic patient for their safety and well-being when they leave the hospital. That might be your goal. All right, so the objectives would be, and not written this way, but how you're going to break that down would be what's their understanding of their illness, what do they need when they go home? Are they insulin dependent? If they are, do they need to check finger sticks? Do they need to be able to give their own insulin? If they're not insulin dependent, do they still need to check finger sticks? Do they need to make dietary modifications? All those kinds of things. Those are the things you're breaking it down into little pieces. And when you get to each of the little pieces, then you're going to write a specific objective for your teaching. So when you get to the specifics, that's where you're going to use your SMART acronym. So specific, writing very specifically what you want to have as an objective. These can't be vague. They have to be very specific, and you'll see. Measurable. How are you going to know that it was completed? It needs to have some form of a measure in it. Achievable. Sometimes we write objectives that just never in the history of the world are they going to be achieved. So they have to be achievable, and especially within a time frame. Realistic. Sometimes we say we want our patient to have a complete understanding of how diabetes affects their body. I can tell you most of us, and probably half the physicians in the world, don't have a complete understanding of how diabetes affects the body. So that is not a realistic objective for your learner. And lastly, it's got to be timely. There has to be a time frame attached to all objectives. So if you say, I want my patient to understand how to give an injection, how, when, where, for how long, or how many times, and in what period of time are they expected to learn it? So it's sort of hard to teach this abstractly. So let me move on to the next slide, and you can see some things that go wrong with writing. So common mistakes. I coughed. That doesn't mean I have coronavirus. Not being learner-centered, describing what the instructor will do rather than learner. So sometimes we'll say the nurse will, and that is not the right way to start an objective. It should always be the learner will. That is how objectives should start. It should always remain learner-centered. You can't include more than one specific behavior or a single objective. So sometimes we'll say the patient will understand finger sticks and dietary restrictions related to diabetes. Two things. You cannot measure two things in one objective. So again, you have to specify it. Then you would break, if you wanted them to understand both of those conditions, you would break that into two objectives. Sometimes an error is made when we don't identify all the components. We get part of it. We might put the condition in the performance, but we didn't put a criteria, or we didn't say who. And sometimes people get annoyed with writing objectives because they get sick of saying the patient will, or after this, the patient will. But you have to continue to put the patient as the focus, or the learner, however you want to word it. You have to put that person in there because that's part of the who that you're identifying always in your objectives. It's what helps you keep them learner-centered. Okay, using terms that are subject to multiple interpretations. Like when we say the words know, understand, appreciate, feel, learn, they're not action oriented. They're still adjectives, so they do describe something, but they aren't an action, and they're very difficult to measure. So if I ask you, could you, after a 5-minute teaching session, could you understand the role of diabetes in your body? Absolutely not. I mean, we still can't understand that to this day completely. So you have to be careful what adjectives you kind of use, and we'll talk more about that. There are certain words that you want to kind of avoid. Some of them are listed right here. Know, understand, appreciate, realize, feel. You want to avoid those because just keep thinking, how would I measure that? How do I measure understanding? It's very hard to measure. So you might want to have them understand a certain thing, and that thing then is what you would measure. I hope that makes it. It's a little abstract talking about it right now, but okay, writing objectives that are unattainable. Sometimes we do this. We write that the patient will have, the patient will completely recover from something, and that's just not going to ever happen probably in their lifetime. So I just want you to always keep looking at that. Is it attainable? Is it realistic? Sometimes we write objectives because there's something we want to teach the person, but it doesn't really reflect the goal. So that in that case, then you'd either need to go back and broaden your goal, add something additional to your goal, which sometimes happens. You get teaching something and you think, that is important information. Let me broaden my goal to include that, and then I can have some specific objectives related to it. So you have to be careful. That's where this internal consistency I spoke about in the previous PowerPoint. Internal consistency. If you write objectives and they don't really relate to the goal, there isn't internal consistency in your teaching plan. All right, and sometimes objectives get cluttered. Like we get too many things going on in one objective. So that would be another place where you'll want to kind of clarify, does this really reflect the goal that I have stated? If it doesn't, then I probably shouldn't have it as an objective. And if I feel like it's an important objective, then I need to modify my goal. Okay, and sometimes things are too general. No specific behavior that you could measure to see if the patient was able to achieve this or the learner actually gained something. So that's where specific comes in. You want to be sure that your objectives are specific. So what's wrong with some of these objectives? The patient will be able to demonstrate the proper steps to performing self-catheterization. Be thinking. I want you to be thinking about that. All right, so if we use SMART, so is it specific? Is it measurable? Is it achievable? Is it realistic? And is it timely? So hopefully you're noticing that some of the things that are missing, there's no time frame to this. So does that mean over their lifetime, somewhere in their lifetime, they'll be able to demonstrate the proper steps to performing self-catheterization? That doesn't really help us when we're sending somebody home to self-catheterize, right? So you want to kind of look at this and say, what's missing? This is a poorly written objective because demonstrating the proper steps. How about saying demonstrating 3 steps in performing self-catheterization after a 10-minute in-service? There's ways to change it. We're going to go on with that. All right, how about the second one? After a 10-minute teaching session, so we've got the time frame, the patient will appreciate knowing the steps required to complete a finger stick. Can you measure, I'm sorry, there she is again. Can you measure appreciate knowing? I can't think of how you would measure appreciate knowing. And also then, so what a lot of people want to do now is stick the word understanding in there. You can't measure that either. So how about after a 10-minute teaching session, the patient will demonstrate the steps required to complete a finger stick. So that would make sense. You've got the patient as the focus, you've got a time frame, you've got something you can measure, and it relates to your goal. So that's a better one, but it's not well written as it is. Okay, during discharge teaching, the patient will be more comfortable with insulin injections. I hope you're already saying to yourself, how would I measure comfortable? And that's the problem with this objective. We like to say that, I'm going to teach you so you're more comfortable with giving an insulin injection. That makes your patient feel at ease, but that's not something you can measure, so it's not to be written in your objective. Then, after being given a list of lower back exercises, the patient will understand how to control low back pain. Well, what do you think? I'll let the little silence rest like it does in the classroom when I'm talking. So that was a little joke. So will lower back exercises, just giving somebody a list of them, help control low back pain? Just handing somebody a list, if that worked, all you'd have to do is hand me a diet and I'd be a supermodel. It doesn't work that way. So we have to look at this and say, what's missing in here? There's missing is the time frame. It's also missing how you would measure this. And it's also missing an actual action from you as the teacher. Okay? Last, the patient will be able to prepare a menu of low carbohydrate foods. Well, who are they preparing a menu of low carbohydrate foods for? When do they prepare it? Where's the time frame? Who taught it? And how are you going to measure that? Just walk in and say, can you prepare low carbohydrate foods? They'd say, sure. So that we've looked at wrong ones. You can always go back and look at these again. Now, let's look at some that I think are better. I may have to pause for a moment. So here's some that are better. Following a class on understanding diabetes, the patient will be able to identify 3 causes of elevated blood sugar. Now, relate that back to the one in the previous slide that said the patient would have an understanding or know, have a comfort level. You know, they're a little different. Number 2, after completing an admission assessment, the RN will create a nursing care plan consisting of at least 3 specific patient needs. Okay. What's wrong with that one? Is that an objective that's patient focused? No. That objective, it's written well, but it doesn't have the patient as the focus. All right. Number 3, after reading dietary handouts, the patient will be able to identify 3 food sources of protein. Okay. It gives a time frame. You'd be able to measure that by asking the patient to identify 3 sources. It has a condition. They want to be able to identify 3 food sources, so that's well written. Last, after a 20-minute teaching session with the RN, the new mother will be able to verbalize at least 2 feelings or concerns she has related to caring for her newborn baby. Now, this is where we get into a little bit of a tricky situation. I told you not to use feelings or things that are unmeasurable like concern, feeling, you know, those kind of adjective words. But in this condition, the way we've written it, the new mother will be able to verbalize, there's the action, 2 feelings or concerns she has related to caring for her newborn baby. That does make it measurable. So in this case, I'm showing you an example of how you would use concern or feeling and still be able to measure it. Okay, so these are better objectives. They're written in a better way. Okay, I'm not going to dwell on this, but I just want you to keep thinking in the back of your mind as you're writing on your teaching plan and you're having your objectives written out. I do want you to try to think of how you would reach all 3 domains. Now, like I said, every goal does not necessarily pertain to all 3 learning domains. So if you're teaching somebody something, like I'm teaching you a course right now on the nurse as an educator, there's cognitive domain in here and I have some affective domain. I want you to have a different understanding in your feeling, an attitude towards education. But I'm not really teaching you a whole lot of psychomotor things. There's no true skills that I can show you. So even though I know how to write objectives and I have a specific goal and learning objectives for your course, I don't have anything in the psychomotor domain because my goal doesn't really determine that I would have psychomotor. Most of the time when we're talking about behavioral objectives, which is 95% of what nurses are going to do with patients. Most of the time, behavioral objectives do have some psychomotor component. Very common. You know, when we're teaching patients, most of the time we're sending them home and we want them to do something actively. Either we're sending them home with a drain, we're sending them home with a dressing, sending them home with medication, sending them home with a new diagnosis that causes them to have to do something different now. So a lot of times we are measuring psychomotor. Most of the time in nursing-driven education, in patient education, we have cognitive domain and psychomotor domain are easy to identify, and it's quite difficult for us as nurses to identify affective domain. So I just want you to think about that. If you write your whole teaching plan out, I keep calling them treatment plans, sorry. If you write your teaching plan out and you don't have an affective domain, there's a good chance that there isn't one. All right, there just isn't one that needs to be addressed based on your goal. But I'm looking specifically for cognitive and psychomotor domain. You don't need to label them as such, but I will be looking because I know what they are. So I do want you to think, have I covered all 3 learning domains if it's feasible for my teaching session?